Alright, good day guys. Welcome again to my channel, Dr. Paramount, a go-to destination for orthopedic insights and practical skills. I am your tutor, Dr. Castabola. Alright, today again I'll be sharing some things with you as regard conservative management of fractures in orthopedic setting. Okay, last class I talked about the steps in applying plaster of Paris or other materials as far as managing fractures conservatively is concerned. So if you want to get more knowledge on that, you can go through my previous lecture and get the adequate pattern of applying cast to hold fractures conservatively. So today, I'm going to be talking briefly on the various equipment and materials in orthopedic settings for cast application as well as trolley setup, because as a technology or as a technician or as an individual that is interested in knowing what it takes to manage a fracture or to manage bone condition, you have to know some equipment and materials that are used in treating fractures and other conditions related to orthopedic setting. So I'm going to be talking about that briefly. What are the equipments we have? What are the materials and what are they using them for? And talk a little about trolley setup as well. Alright, the first thing I have here is there's something we call plaster shears. So plaster shears is one of the equipment we use in orthopedic setting for cast application. So anytime a cast is applied and it has to be removed immediately, maybe few minutes after the cast application, the cast is still wet. So we make use of plaster shear to remove a wet cast. Mind you, if the cast is dried or the cast is hardened already, plaster shear cannot be used. So what the plaster shear is meant for is to remove the cast that is still wet. So immediately after the application of cast, plaster shears can be used for practicals. For practical sake, if you are applying POP for practical sake, you want to remove it immediately, that's where plaster shears comes in. Alright, so we have something we call plaster spreader. So in case you want to remove plaster of Paris, you cut through the plaster of Paris, you want to remove it, you have to get something we call plaster spreader. That's exactly what you're going to use to whiten the cast for the removal. So because when you cut through the cast, there has to be enough space for you to be able to take off the cast. So plaster spreader is the one that will help you in spreading the cast so that it can be taken off. Alright, we have something we call crepe bandage. In orthopedic setting, crepe bandage is used for various bandaging. If there's a need for suspension of the cast, if there's absence of capelline bandage or cotton bandage, crepe bandage can also be used. Alright, we have something we call cotton bandage. Cotton bandage are used for various purposes. One of the things that we use cotton bandage for is for the application of collar and cuff, whereby we use it for suspension. So for patients that has fracture of the upper extremity, any patient that has fracture of the upper extremity, after the cast has been applied, they have to suspend the hand in 90-degree flexion. So after suspending the hand, something will definitely hold the hand in that suspension, and that's what we call the collar and cuff. So that collar and cuff can be made from what we call cotton bandage. So another thing we can use cotton bandage for is for skull fracture management. So if there is skull fracture management, we will not be using POP for the management of skull fracture. So there has to be other things. Part of what we use for skull fracture management is what is called cotton bandage or capelline bandage. In subsequent lectures that we'll be talking about fractures that we cannot manage with POP. Alright, so we have something we call rocker, walking rocker. This walking rocker helps in ambulation for fracture, for cast of lower extremity, for lower extremity cast. So there has to be times where patient needs to walk, or sometimes patient needs to do some ambulation. So this walking rocker is applied to the heel aspect of the lower extremity cast. What it does is just to make sure there is ambulation of the patient. The patient can walk with the cast with the help of crutches. So that's what it does. So we have another one which is called plaster bender. What plaster bender does is just to make sure there is a space. There are many spaces in the cast. In case you apply a cast and the cast is tight, you from your assessment of the cast you apply, you notice the cast is tight or patient complains of the tightness of the cast. There are times you may remove the cast or you use plaster bender to just widen the cast so that there can be more space to accommodate the cast. So that is what plaster bender is used for. We have something we call plaster saw. We have manual saw and electric saw. Electric saw can also be called oscillating saw. So manual saw can be used for the removal of cast, whether it is wet or whether it is hard. So if the cast is hardened, if the cast has passed every stage of setting and it has hardened after 3 days, you can use manual saw to remove them. It's different from the plaster shear I talked about the other time. Plaster shear can only be used to remove wet cast, but this manual saw can be used both to remove wet cast and hard cast, dry cast. But electric saw or oscillating saw are casts that can be used. You have to do it with electric. It has to make noise, bring some sounds with cast remover. So those are the two the saw we have. Then we have what we call autobahn. Autobahn is a padding material that we use to protect the skin. There are many protective materials we have. As far as skin is concerned, we can make use of autobahn, we can make use of cotton wool, we can make use of felt, we can make use of many things. So, but out of these protective materials on the skin, autobahn has to be the most respected aspect that we need on the management of patient skin, because it can absorb more sweat than any other protective material. Felt are protective material we use to cover bony prominence. It's not going to cover all the body of the patient. So autobahn, we use autobahn to protect the patient's skin, not to have direct contact with the plaster of Paris. We have something we call knee rest. In applying lower extremity cast, there has to be a time we have to rest the knee so that the cast can give us the better shape, and it will be at patient convenience. So knee rest will be placed at the knee region posteriorly. So knee rest is used for that management. Then as regard the plaster setting, the plaster room setting, we have something we call X-ray viewing box. X-ray viewing box basically is used for viewing X-ray. You know, as a technologist or as a technician, the first thing you need to do in assessment of the patient has to be something that related to X-ray. So X-ray will be the one to guide you, to lead you, as I said in the previous class. So X-ray viewing box is a particular setup that is located in the plaster room, whereby you put your X-ray there that will give you a better picture of what. If you hold X-ray, there are many times you may not have a clear picture of what you are holding, but X-ray viewing box will give you the better picture. Once you put your X-ray there, it's going to reveal everything as regard the management of the cast you want to talk about. Another material we have and the equipment we have is what we call plaster scissors. We use plaster scissors in cutting excess plaster. Maybe you are applying now, you are applying, then you want to stop the cast and waste the remaining material. You can use the scissors to cut through the plaster and just dispose the rest. Then we have plaster knife as well. In case you are applying cast, because POP comes in inches, we have 3 inches, we have 4 inches, we have 6 inches. So in case you want to apply a cast, but you have some inches that is bigger than what you're expecting, maybe you have 6 inches now, but where you want to apply the cast to may be something around this metacarpals. So using 6 inches directly on this kind of place may cause your cast to be wrinkled. So in that case, you have to cut through the cast, cut 6 inches into 2. You can make use of plaster knife to cut through that, which is going to help you. Alright, so we also have gloves that we apply. The technician and the technologist, both the assistants and everybody put on gloves. That is just brief aspect, that's just the brief aspect of the equipment and materials we use in orthopedics. Okay, right now we're talking about the trolley setup. How do you set up a trolley if you want to apply a cast now for a patient, if you want to manage a patient conservatively now? You need to put on some trolley setup, which is going to help you to apply the cast expeditiously and to apply the cast with convenience. Alright, I've divided it into top shelf and bottom shelf. So there has to be materials and equipment that will be on the top shelf. There has to be materials and equipment that will be at the bottom shelf. So at the top shelf, we divided into 2. If you want to apply the cast now, there has to be some materials and equipment that you will put on the top shelf. Then if you want to remove the cast, there has to be another set of materials and equipment that will be put on the top shelf. So I'm going to do justice to that. The top shelf, if you want to apply the cast now, you want to apply any form of cast, whether it is upper extremity cast, whether it is lower extremity cast, or whether it is body cast or any form of cast. So if you want to set up your trolley top shelf, there are things you need. Number one is that you need a bowl of water, and you need water inside. So you need a bowl of water, and you need some water, some level of water inside, and your water has to be it has to be warm, so as to give your cast a fast setting. So that's one of the things that you need. Another thing, you need plaster of Paris bandage in various sizes. You want to apply a cast, that you must have prepared plaster of Paris on the table, on the top shelf of the trolley you want to do. Then we have padding materials. Like I said the other time, you make use of, you provide autoband so as to get the patient prepared. Then we have plaster knife to cut excess cast or to cut the cast into 2. We have indelible pencil. So indelible pencil is used for after you have completed the cast. you use indelible pencil to write what the procedure that has been done. The procedure that has been done, you write it on the cast. Maybe the patient wants to be transferred to another hospital. If the patient is transferred to another hospital now, if another technician is assessing the patient, he or she must have seen what was done, even without checking the X-ray, because there are casts that serves more than one purpose. So in that case, indelible pencil must be used to write the procedure that has been done. Maybe, okay, let's say for instance, I applied a Collis cast on the patient now, I will write Collis. So that is what indelible pencil is used for. Then we have plaster scissors as well to cut SS cast. Then we have gloves for the application. Now for the remover now, we need some things for the remover. At the top shelf this time around, what I talked about the other time is top shelf for application. Now top shelf for cast remover. Now if you want to remove cast, you have to prepare another trolley for your patient. So at the top shelf, now what are things that will be there on your top shelf? You need your plaster shears. If you want to remove the cast, wet cast, you need your plaster shears. Then you need your manual saw to remove hard cast manually. Then you need your plaster scissors as well. Then you need your face mask to prevent yourself of this dust that will be coming from the cast. Then you need your plaster knife. Then you need some other gloves and other protective materials if you want to set up the trolley, the top shelf now. So those are the top shelf for both applications and removal. Now let's move to the bottom shelf. Bottom shelf now generally either for the application or for the removal. What are the things that are needed at the bottom shelf? Number one is bowl for receiving waste material. Don't forget I made mention of one bowl in the first place. That one, the first bowl I mentioned is about water, is for water rather. This time around, the bowl that you will need at the bottom shelf will be for waste material. When you put your POP on top of the shelf and you unwrap them, all those waste materials must go directly into the bowl that is at the bottom shelf. So you need that, number one. Number two, you need more protective materials for your patient and for yourself. That is apron. You put your apron, protect yourself. Also, you put on marking touch on your patient. So all this must be put under the bottom shelf. All right, another thing is pillow. You have to support the head of your patient while applying, and there are other casts that you need to support the leg as well. So pillow must be there under the bottom shelf. Then another thing we need is knee rest, heel rest, elbow rest, and back rest. All these rest must be at the bottom shelf. All right, another thing we need is flannels for cleaning. If you want to clean your patient at the end of the day, or you want to wrap up the cast to make general cleaning, you need flannel to clean your patient. So this must be at the bottom shelf as well. And lastly, you need cast boots for assistants and patients. You need to put on cast boots. Your assistant, if you're a technician, you put on your cast boots. If you have an assistant, your assistant will put on cast boot as well. All this must be under the bottom shelf. So we have materials for the top shelf, we have materials for the bottom shelf. So generally this is the pattern of how we set up trolley in orthopedic setting to help you apply the cast without wasting time, to help you apply the cast and making the process of the cast application so easy, and it will give your patient the best treatment so far. Alright guys, that will be all for today's class. Do well to go through the lecture again and make sure you get what you are trying to get there. In my next lecture, I will be talking about other things that are necessary in the management of cast conservatively. Do well to subscribe to this channel and click on the notification bell so as to get notified anytime new videos are posted here. And don't forget to share as well. For guidance and mentorship, you can copy the number you have on your screen. See you in the next class.